Hi everyone, I'm Maya Hutchby. I'm a freshman at Fieldston High School in Manhattan, New York, and this is my comparative study of the treatment options for young adults with aneurysmal bone cysts, also known as ABCs. I first discovered my passion for learning about these cysts when I found out that I had one. My hip had been hurting for around 2 years prior to when I found out, and the only reason why the doctors came across the cyst was because it caused a pathological fracture in my pelvis. Even after the surgery, the cyst is still there, which is what has been encouraging me to do research and raise awareness about this disease. Aneurysmal bone cysts are an important disease because even though they are a benign tumor, they are locally aggressive and left untreated can cause pathological fractures. These are some examples of body parts affected by ABCs. It's easy to misdiagnose them because they appear differently on X-rays, CT scans, and MRIs, and they can be mistaken for giant cell tumors or simple bone cysts, as shown in the images here. The main treatment options for ABCs include doxycycline sclerotherapy, cryoablation, curettage and grafting, and denosumab injections. The treatment someone receives depends on their cyst. Doxycycline sclerotherapy is a safe and effective standalone treatment option for ABCs, with high success rates observed in various case studies. It is a minimally invasive procedure where doxycycline is injected locally. One study treated 77 lesions with a 99% success rate, while another achieved an 86% success rate for cervical spine ABCs, showing its viability for both easily accessible and challenging anatomical locations. The procedure has a low complication rate and high patient satisfaction, with most patients reporting minimal to no pain or functional impairment post-treatment. These studies show that doxycycline sclerotherapy is an effective, safe therapy and should be considered a first-line standalone treatment option. Curettage and allogenic bone grafting is another effective treatment for ABCs. The technique, which involves using a small incision to scrape out the cyst and inject allograft paste, proved successful in a study of 19 patients with a mean age of 9.6 years. Within 6 months of the procedure, all patients were active, pain-free, and had a full range of motion, with no reported complications such as fractures or infections. This treatment option combines two of the most common surgical treatments for ABCs, curettage and grafting. Cryoablation is a relatively new treatment, which is also safe and effective for ABCs in children, as shown in a study of 7 patients with a mean age of 8.7 years. After an average of 2 cryoablation treatments per patient, there is a substantial mean reduction of 81.9% in lesion volume. In addition to promoting bone remodeling, the treatment also provides prompt pain relief. This study concluded that cryoablation is a minimally invasive treatment option for ABCs, with patients demonstrating partial or complete responses. And as seen in this picture, thin probes are injected into the site where the ABC is, and they release freezing gas, which causes the cyst to freeze and then shrink. Denosumab injections are the primary systemic treatment for bulky, inoperable aneurysmal bone cysts. The treatment effectively reduces tumor size and causes ossification, improving clinical symptoms like pain and neurological deficits. However, its use has been linked to severe hypercalcemia, especially in pediatric patients. A case series noted that 28.6% of children treated with denosumab developed severe symptomatic hypercalcemia, sometimes requiring intensive care admission, and this rebound effect can occur months after treatment is discontinued. Consequently, denosumab use for ABCs should be limited to specific inoperable cases due to the serious risks of hypercalcemia, particularly in children. Looking at the literature review, bone grafts and curettage were the most common, but doxycycline sclerotherapy stood out. The treatment option which is recommended is based on the cyst depending on where the cyst is or the size of it. For example, if the cyst is somewhere that is inoperable through surgery, treatments like doxycycline sclerotherapy and denosumab injections would be the go-to treatments. The best overall treatment is doxycycline sclerotherapy because it is safe and effective. In one research paper, it had a 99% success rate, and only one of the 77 patients needed surgical excision. While it isn't the most popular one, it is the most successful. Limitations included only a small number of existing papers evaluating recurrence rates. In the future, I would strongly recommend more research to be done on the recurrence of ABCs because the accuracy of the treatments depends on whether or not the cyst relapses. Thank you for listening.
Awesome. Thanks, Maya. I'm so sorry to hear, your interest and right, like learning about this came from personal experience. Um, was it difficult to research something that you had like such a, like the most personal, right? Like literally of your person kind of experience with, or was it kind of like therapeutic to learn about it in this different way?
Yeah, I think it was really therapeutic for me because when I found out that I had the cyst, honestly, I was very grateful it wasn't cancer. And um, for me, it really helped just diving right in and figuring out, okay, what treatment options are there? What is the best one for me? So, yeah. And it really helped because when I had the surgery, I like actually knew what the doctor was doing.
Yeah.
And it wasn't like, okay, so you're gonna do this, and I have no clue what that means. But okay, yeah.
Yeah. But sure, go for it. Okay, great. There are a couple of questions here in the chat I'll read out loud. The first is, what are the common complications or side effects of doxycycline sclerotherapy, and are there risks of failure after the procedure?
Yeah, so thank you for the excellent question. And for a lot of these treatments, the only way to determine the best treatment option is based on recurrence. And because doxycycline got rid of the cysts the fastest and it had much lower recurrence rates, say that's why it's best, and that's how we test for failure. Side effects for doxycycline, I'm not sure there were any. I do know that the pain relief wasn't as fast as cryoablation or denosumab injections.
Okay, great. And the second question, since ABCs can look like giant cell tumors on scans, did the studies you use confirm diagnosis with biopsy or just imaging? And also great work on your research. Got to include the shout out.
Thank you for the question. And biopsies are very important in determining what kind of cyst you have because aneurysmal bone cysts are filled with blood. So when they take the biopsy, if they see, oh, this cyst is filled with blood, okay, it's an aneurysmal bone cyst. But for giant cell tumors, I'm not sure what they're filled with. It could be a different type of liquid. It could be just air. Yeah. So biopsies are very important for this. And I actually got 2 biopsies before they could decide on what treatment I should receive.
Very nice. What would you kind of like, what would you hope to see the field researching next about ABCs?
I think recurrence is something I would like to see more research to be done on because there's a 20% chance of the cyst relapsing. So that's really important. And yeah, I think just focusing on that and more research being done on treatment options that don't take as long because It takes a while to heal from some of these treatment options. Like, I was in a wheelchair for many months.
Wow. Yeah, yeah, that makes a lot of sense. It's kind of two great pathways to keep exploring and everything. Yeah. Okay, wonderful. Well, Maya, thank you so much